Severe intellectual disabilities. Individuals with severe intellectual disabilities typically have little understanding of written language or concepts involving numbers, quantities, time, and money. Caregivers must plan extensive support for problem solving throughout the individual's life because they are unable to make decisions regarding their well-being. Spoken language is limited in vocabulary and may be single words or phrases possibly supplemented by gestures, signs, or pictures. Communication tends to be focused on the here and now within everyday events. Relationships with family members, friends, and familiar others, like caregivers, are a great source of pleasure and help. Individuals require support for all ADLs and supervision at all times. Some individuals may demonstrate disruptive behaviors that are challenging for family members to manage. Profound intellectual disabilities. Individuals with profound intellectual disabilities have very limited conceptual skills and at best can understand concrete objects, but not symbols such as pictures or words. They can learn skills such as matching and sorting based on physical characteristics and may use objects for specific purposes such as self-care and recreation. They may understand some simple instructions with gestures and often express their desires and emotions through nonverbal, non-symbolic communication. They enjoy relationships with well-known family members, caregivers, and familiar others, and can initiate and respond to social interactions through gestural and emotional cues. However, sensory and physical impairments limit the amount and quality of social interaction, so extensive support may be required to ensure that social interaction occurs. They are dependent on others for all aspects of their care, health, and safety. If there are no physical impairments, they can assist with simple chores around the home, such as putting dishes away. With support, it is possible to engage them in vocational tasks that depend on simple actions with objects. Recreational activities may involve listening to music, watching movies, going for walks or water activities, all with the support of others. Without support, they often spend a lot of time just watching others. They may demonstrate disruptive behaviors. Individuals with developmental disabilities generally have few physical limitations. The majority of their care needs are based on supervised decision-making, and ensuring safety needs are met, because these impairments begin at a young age. Caregivers must provide opportunities for individuals with developmental disabilities to be as independent as possible and integrated into everyday life. This philosophy is reflected in the legislative acts previously discussed in the history of care for individuals with mental health disorders and developmental disorders section, with individuals having developmental disorders placed in small, community-based group homes if their care is unable to be managed by family members in their homes.